Hello students, now I am going to discuss about the ethmoid bone. This is a single bone. It is cuboidal in shape. It is thin, irregular, fragile and pneumatic bone. It is situated in the anterior part of the base of the skull and it contributes to the formation of the medial wall of the orbit, nasal septum, roof and lateral wall of the nasal cavity and part of the anterior canal fossa. It consists of a thin horizontal perforated cubium plate and a pair of lateral labyrinths. This is left labyrinth, this is right labyrinth. Each labyrinth is projecting downwards from the lateral margin of the cubium plate as a thin air-filled fragile bony mass. Now description of the cubium plate. This plate fills the ethmoidal notch between the two orbital plates of the frontal bone. You see, this is the ethmoidal notch which is situated between the two orbital plates of the frontal bone, and this cubium plate fills the ethmoidal notch. Now, in its surface, there are so many apertures on each side. These are 15 to 20 in number on each side for the passage of olfactory nerves and their arachnoid coverings. This cubium plate has one posterior margin, this is the posterior margin, and one upper surface, and this is lower surface. Now, this posterior margin of the cubium plate articulates with the ethmoidal spine of the body of the sphenoid. That is the anterior border of the superior surface of the body of the sphenoid. Now this is the upper surface of the cubium plate. This forms the floor of the anterior canal fossa. You see, this is the upper surface of the cubium plate. This forms the anterior floor of the anterior canal fossa. And this lower surface, this is the lower surface. This surface forms the large part of the roof of the nasal cavity. Now, in the upper surface, in the front portion, in the medial plane, you see there is a small, thick, smooth, triangular crest. This is projected upwards. That is known as crista galli. You see in the articulate skull, this is the crista galli. It has two borders. This is the posterior border. You see, this border is thin, long and curved. That gives attachment to the anterior end of the falx cerebri. And this is the thick, short anterior border. You see, this border diverges into two ala. This is the two ala, diverging ala. This ala joins with the frontal bone to form one foramen, that is posterior boundary of the foramen cecum. You see, through this foramen, one emissary vein is passing. that connects the superior sagittal sinus with the veins of the nose. Now, the perforated plate on each side of the crista galli supports the olfactory bulb and olfactory tract and gyrus rectus of the frontal lobe, and it gives passage on each side of the crista galli for anteroethmoidal nerves and vessels. Now, lower surface of the kidney plate. You see, in the lower surface, in the medial plane, there is a thin, flat, quadrilateral perpendicular plate of the ethmoid bone. This plate forms the upper or anterior part of the nasal septum. This is the perpendicular plate of the ethmoid bone. It has anterior border. This border is projecting downwards and forwards, and it articulates with the nasal spine of the frontal bone and crest of the nasal bones. And inferior border, it receives the septal cartilage of the nose, and this is the posterior border of the perpendicular plate. You see, this is the posterior border of the perpendicular plate. This is the posterior border of the perpendicular plate. This border articulates above with the sphenoidal crest and below with the upper part of the superior border of the vomer. And this perpendicular plate has two surfaces, that is two lateral surfaces. These surfaces are smooth and covered by nasal mucous membrane.